Public health officials say if we want life to return to normal, then we'll have to depend on contact tracing. That means identifying and isolating everyone with COVID-19. There are a lot of rumors on social media about contact tracing. We want to make sure you know what's true. Maher Kawash breaks it down for us.
If you test positive for COVID-19, you'll likely get a phone call from the local health department. They'll ask you to stay home for 14 days and call or text you each day until you're feeling better. Health officials say people with COVID-19 are contagious 2 days before they start feeling sick. So that's why they'll call anyone you are within 6 feet of for 10 minutes during those 2 days and ask those people to self-isolate too. Now, many of you have asked what happens if you don't comply. If a health official is worried about that happening, they'll have you sign this form. If you still don't comply, you could face a fine or jail time.
If I have significant concerns about somebody being out there when they shouldn't be, then it can be enforceable by law.
Self-isolation is supposed to be voluntary. They don't want to enforce this. Another popular question, will I or my kids be placed in an isolation center? No. The state has some isolation centers available for foster kids or people with no safe place to go. At no point will anyone drag you or your kids out of your home. We've also been asked why the National Guard is involved. They're only acting as volunteers, not law enforcement, just like the help they're giving at our food banks. And the biggest concern for many of you, your privacy.
We're bound by the same exact confidentiality laws that a healthcare provider is required to abide by.
Your information is confidential, just like it is at a doctor's office. Contact tracers will not ask you for any personal info either, like your immigration status, marital status, or social security number.